the panelists open their cameras, but mute their mics. And also, everyone else, please mute your mics. Yeah, thank you so much. So we're going to start the call. Thank you so much, everyone, for joining us again. This is our part 4 of our every 2 weeks advocacy dialogue series, where we talk about the effect of COVID-19 on children's rights. In each dialogue, we choose different topic. So this week we have a very exciting topic. We have child protection systems, and we have very excited panelists who are going to join us on the call. And then we have Save the Children, Somalia, Somaliland, head of child poverty reduction Chad, who's going to be the moderator for this call. Please, if you are not panelists, please mute your mic and your cameras. Thank you so much. So I'll try to introduce you the kind of rules we follow in the call. Everyone's supposed to turn off their cameras, mute their mics, except the panelists. Thank you. And this call will be maximum 1 hour to 1 hour and a few minutes. The call is being recorded. If you have any questions or comments, please put them in the chat box. We will try to cover them and pick them. And also, if you have any kind of recommendations or anything at the end of the call, you can always put that in the chat box, and we're gonna try to capture them. Now I will welcome Chad. Chad, the floor is yours. We're looking forward to the great discussion. Thanks, everyone.
Thank you so much, Ayan. And thanks to everyone who's able to join so far. I know this is part of a discussion series, and it's the 4th one. It's at a slightly different time than usual. So thanks to everyone who's still able to join at this time. Excellent. So today we've come together to discuss cash transfer programming through a lens of COVID-19 and beyond. I just want to check if everyone can hear me, and if everyone who's maybe not online or not speaking at the moment can mute their mics. I just heard a bit of background noise, and I hope others can't hear that background noise as well. So if you can just mute your mics, and then we'll continue. Excellent, thank you. So in having this discussion today, we've brought together 4 very well-informed panelists to have a deeper dive into this topic. So first I'll introduce our panelists briefly, and then I will go in and kind of set a scene for our discussion. So the first panelist we have with us is Kamal Isaac Hassan. He's the Youth and Protection Program Manager at Havioko. And Kamal will talk with us about the impacts of COVID-19, specifically the impacts of COVID-19 containment measures, so the policies and restrictions that governments put in place on Somali youth and Somali families. Save the Children has had a long working relationship with Kamal. Havioko is one of our local partners in Hargeisa. And then we will speak with Alessandro Bini. He's the director of the Somali Cash Consortium. The Somali Cash Consortium is a group of NGOs that come together to design, implement, think about, learn about cash programming. And it's really a thought leader in cash programming for Somali people. And what we'll discuss with Alessandro is the challenges and opportunities that we faced really in the midst of COVID-19, and as we continue to deal with COVID-19, and how we dealt with those and how we faced those. Then we'll talk with Barbara Laseni. Barbara, actually, we're very lucky to have Barbara with us right now because she's usually the humanitarian cash and safety net specialist with the technical assistance facility for Somali people on safety nets. However, she's just on a little bit of a break, so she's joining us in a non-professional capacity at the moment. But she's very much engaged in this space and will continue to be engaged in this space as we move forward as a community. with Barbara, we'll talk a little bit about what humanitarian actors can do a bit differently as we move forward to continue and face cyclical shocks like COVID-19, but also other shocks related to climate as well. And then lastly, we will hear from Christelle Tesfaktema, who's the social policy specialist for the UNICEF country office. And we will discuss with her really some exciting stuff on how to build back better from COVID-19 and be more prepared for other shocks. So before we dive into those discussions and the wider discussion, let me first maybe define for us cash and voucher assistance. As I do so, I'll just remind everyone on the call, if we can all go on mute, then we can limit the background, any background disturbance. So just a brief introduction or brief definition really of cash programming. There's a group called CELP, the Cash Learning Partnership, and they define cash and voucher assistance programming as programs where cash transfers or vouchers for goods or services are directly provided to recipients. So this is usually in the context of humanitarian assistance, and they can be used to refer really to cash transfers or vouchers given to individuals or households or community recipients. That does not include things like remittances that are received from abroad through other channels or things like microfinance. But it includes really the cash going through mobile money, et cetera, to through humanitarian interventions. And so the objective for us to come together today is really to reflect on our experience as humanitarian organizations in implementing cash programming throughout COVID-19 and as we continue to deal with COVID-19, but also beyond, to really rethink a little bit about how we've been working and how we can maybe work a bit better. So just, I think, a question for everyone, and we can use the chat box. I want to ask, because we have a variety of people with us and society and civil society with us on the call today. Some of us are engaged more in cash, and some of us might be less engaged in cash programming. So I wanted to ask, but for everyone, how many people did we reach as a humanitarian community? How many Somali men, women, and children did we reach in June 2020? So last month. Take a guess, put it in the chat box. How many people did we reach in June 2020? Or how many households? Either answer works fine. Was it 5 million? Was it, so yeah, please type in any sort of estimation. I'm getting one saying 2 million people. Any other guesses? Just type in the number. If someone gets it extremely close, we're already getting close, to be honest. Okay, 7 million, 2 million, a couple more, and then I'm just going to 3 million. I saw too many, 3 million. Okay, so 2.7 million. Excellent. So basically, we reached in June as a humanitarian community what was reported to the cash working group. Okay, 1.4 million, 5 million. We're all coming in around the right number, almost 2 million. So the right number, I think the closest one so far is the last one. Thank you, because it's almost 2 million. It's about 1.8 million people were reached in June 2020. And so that's, obviously during a time when Somalians are dealing with a number of different layers of crisis. Now, can I ask, how much money do you think was distributed directly to these 1.8 million people? Was it in terms of millions? A lot. It's true, it was a lot. Any guesses? This one's more difficult, I understand. It was, since this one's quite difficult, okay, we got a 10 million in. It's higher than 10 million. Essentially, let's get one more guess. Three's a charm, and then I'm going to 30 million. Okay, this is we're getting right around in there because it's about an average of what's been said. What was reported to the cash working group is $23.4 million were distributed directly to the pockets of Somali people. So this does not include programming costs. That's the direct transfer. That's about $13 per person on average, which makes sense because of the different levels of transfer that are provided, which is usually on a per household basis. So just to say again, this is really at a time when Somalis are facing a multitude of overlapping crises, including the economic fallout of COVID-19, but also cyclical climate shocks, that's floods, droughts, and of course now, unfortunately, in different parts, we're dealing with a locust invasion. So this is a very serious concern for all agencies on the call today. Indeed, COVID-19 and the cyclical shocks for Save the Children, UNICEF, the Somali Cash Consortium, and all humanitarian actors is very concerning. It's important that we, during this time, we do recognize that while children are not susceptible or the most susceptible to COVID-19 in terms of health, of course, older persons are more susceptible to the health risks of COVID-19. They're indeed the most susceptible to the economic impacts, which have a direct impact on the access to nutrition at the household level. Unfortunately, this not only impacts Somali men, women, and children today, but it will impact also Somali men, women, and children and the country in the future, because obviously today, undernutrition is associated with around half of all child deaths globally. But as we move forward tomorrow, stunted children, as we see from global evidence, a variety of global evidence, stunted children will usually end up earning 20% less as adults and be 30% more likely to live in poverty. So this is what has us so very concerned about the multitude of different layers of crises that Somali families, men, women, and children are facing today. And this is one reason that makes cash programming so critically important right now, to ensure that we continue to do our best to ensure access to nutrition throughout the life cycle, but specifically for children in Somalia and Somaliland and other regions of the country. So it's indeed, I think that's probably enough from me. I think if we go directly into the panel, that will probably be allow us to really start diving deep. So I'm going to ask now if Kamal from Havioko can speak with us about how COVID-19 containment measures affected Somali families. What was really the impact at the household level? In here, I hope we can discuss things like what were the impacts on the labor market? What were the impacts on access to food? What were the impacts on youth specifically as well? Kamal, can I invite you to speak with us and do a bit of a deep dive into that?
Thank you very much, Mr. Chad Anderson. Firstly, I would like to thank Save the Children Somalia, Somaliland for inviting me this wonderful dialogue that we were discussing the situation of cash transfers throughout the Somalia, Somaliland. And if I come back, the question of Chad asked me, really, when it comes to the impact of COVID-19, the Somali families, as well as the young people of Somali people, are really, as I know, as we all aware of, it has impacted a lot. For example, when it comes to households, as we know, the Somali community, a majority are poor families, poor people, I mean. So when this pandemic, COVID-19 came into the country, it is affected all the lives of the people. So particularly the household or the families, they face difficulties for getting food, for getting health services, for getting whatever is affecting the lives of the person. When it comes to the young people of Somali, young people or youth in Somalia, Somaliland, really this pandemic has affected a lot. For example, in 2019, a lot of young people have graduated the country universities, which wanted to get a job, get access to a job. Unfortunately, when this pandemic has come, it has affected everything. For example, they miss what's called internship opportunity or job placement, where the young people can get access to learn how to work and how to do the work. And a lot of also many young people and even the adults, they lost their jobs. For example, the private sector. A lot of businesses has collapsed during the pandemic. That's caused the unemployment is become higher than usual. And went back to as well as the families are different. For example, the families now, today that I'm focusing on the households that located the vulnerable community or the IDP camps, wherever they locate in the context of Somalia, Somaliland. These people, as I know closely and contacted many times during the pandemic, and now really their life is still very difficult. Some people might not get food for example, the Somali people, they always use 3 times of meal. So as we currently know, out of the 3 times, some people can get 1 time due to this pandemic. And the whole country economic also, Mr. Chad, getting down and become low. So thank you for your question. And if I continue my speech, I would also add the vulnerability of household in Somali context also is increasing. As you know, what's called social protection systems in Somalia, Somaliland, is not existed before. But as we recently do in some projects, like for example, child-sensitive social protection, we are currently improving and developing social protection systems. We know the social protection systems has different schemes. Currently, we are doing, for example, child grant, which is supporting mainly children to access education and health services. Therefore, this pandemic or coronavirus has also impacted the lives of the community. And as we know, the cash transfer program during the social protection system, it is very important component to reach the vulnerable community. And therefore, this pandemic or coronavirus has impacted the lives of the families because of the people. They get locked down. The government has imposed restrictions, and these restrictions cause it to not do anything. For example, in Europe countries, when they said please stay at your home and there is a lockdown, maybe the government is also supporting the people who are staying in their household. But unfortunately, in the Somali context, Somaliland or Somalia, there is no any further support that the people are getting. And the other problem that households also face it. Majority of the Somali community, they depend on what is called remittance from the abroad. The families who live in the abroad, they send money to their relatives where they are living in ADB, where they live the host community. But unfortunately, the people who stay in the abroad, they could not afford to send money to their families. And that's also impacted the lives of the community. On the other hand, the coronavirus in the Somali context Somalia and Somalia, it has also impacted the food prices. For example, the market is when everywhere is closed, for example, the ports, the airports, everywhere in the country, then the food price is getting higher. Although, for example, the government of Somaliland is announced to not add any to make extra price for as usual, but the people, they are not listening the government rules, and everybody is selling whatever he wants his commodity and materials. So that also affected the food price of the family, and the poor family, they couldn't afford to buy any food. And as we have resulted, it is increasing what's called mentally stress and trauma. The people become traumatized. Many people become mental ill, and while others become so stressed. And so actually, this coronavirus has impacted a lot of lives of the community, families, households, the young people. And we know also the nutrition of the children. I know currently a lot of young people, young children, we say the ADB camps now become malnutrition, and severe malnutrition. So in my conclusion, I would like to say the cash transfer program will play an important role to compensate what's called the loss of income to the households in the Somali context. Thank you, Chair. So if anyone has questions, they can feel free to ask me whatever needs a clarification. And yeah,
thank you so much. Thank you so much, Kamal. We will have time for questions just in about 20 minutes. And as I will sort of recap and at the end before we go into further questions. But I just want to say, because the line was breaking up really just ever so slightly at one stage, and I think when we were talking about remittances, I just want to emphasize how the remittances were so important for Somalis, and obviously that really shows a connection with the impact of COVID-19 on many other economies, places like Sweden, Canada, the US, and the UK, and other places where Somali diaspora are living, where they may have lost access to their income or other forms of financial support, and that also had a big impact on financial flows to Somalia, which is quite substantial because it is estimated that remittances make up 29% of GDP, and that's about $1.4 billion a year. So it's quite a substantial amount of money that is that would usually be coming into the country, which has been slowed down to a large extent. So it's quite concerning, and also makes the cash response so much more important. And so on that note, I would like to turn over to Alessandro from the Somali Cash Consortium, and ask to discuss a little bit more about the challenges and opportunities. So the question for Ali is, what challenges and opportunities did we as a humanitarian community face when trying to continue our essential cash response, but also scale it up during this critical time, and also a time that was very difficult to operate in? Ali, will you be able to dive into that deeper with us?
Sure, thanks, Chad. I'll try my best. So first of all, really, I would like to thanks as well Save the Children Somalia for organizing this, and yourself and Kamal with the first sort of answer for setting up the context of Somalia. So obviously COVID-19 for Somalia comes on top of a number of other humanitarian challenges, which we were all trying to respond to already. What have been the specific challenges from COVID-19? Some are fairly general in the sense that they are not referring just to cash and voucher assistance. They are in terms of funding, as I believe you mentioned as well. Not a lot of additional funding have been made available, right? Just because so many countries in the world and their economy has been affected. The second, which affected all humanitarian organizations working in all different sectors, is the actual normal functioning of humanitarian organization has been affected. So the time when we are trying to continue and scale up our work, all of a sudden we need to change the standard way of working, because some stuff had to be relocated, because suddenly some traveling to some part of the country is not possible anymore. We are all moving to work remotely. So that's taken a bit of time to adapt to. On the cash side, and as cash consortium, we ask ourselves this question from late February, early March. Immediately as this thing started, we could see it coming to Somalia as well. The question was, how are we going to be able to continue to deliver on our humanitarian objective, reaching people, vulnerable people, delivering cash, but at the same time, we want to keep safe the staff of the agencies working with the cash consortium and make sure that we don't put to any risk communities we work with. How are we going to do that? That was the key question. And I have to say we fairly quickly realized that we have to sort of shift very rapidly to remote working. We were already doing most of our work digitally, and I'll go a little bit on it, but we had to sort of change all our procedure and go working remotely. And this means for doing targeting of location and beneficiary, for doing registration of beneficiary, for the delivery of the cash, of course, and then for the monitoring of the work we were doing and collecting data on it. And probably a key component was as well, we need to make sure that everyone in the community has the possibility of talking to us, talking to the agencies, asking questions, complaining if need be, using these channels. Because the face-to-face from the agents of the organization was not possible anymore, was not available anymore, or was available in a very limited way. So we set up as quickly as possible this remote way of working through a web-based call center, because obviously there were limitations in terms of even in setting up this type of system within Somalia. And then through this system, we were able to talk to beneficiary through the mobile phones, talk to local authorities, village committees, and do this targeting exercise together, and do as well the sort of the standard verification exercise that we do once the targeting is done, all of these doing it remotely. Now, in this picture, the fact that as Cash Consortium and the agency member of the Cash Consortium, we were already using mobile money was a lifesaver, I'd say, because we're already delivering cash remotely without asking beneficiary to move, to travel, to go and meet anyone. And we didn't need any of our agent to go and meet with beneficiary. All of this was happening already through the mobile money system. So we were able to use this system and build around it all the other mechanisms and do everything remotely. So having that system working, I would say, so well in Somalia was really in the context of COVID proved to be really as a great opportunity and a great value, a great asset. And I have to say, maybe just to close on that, I think that could be going forward an opportunity that we could all use more. We do a lot, obviously, especially in cash and voucher assistance, using mobile phones and the mobile money system. Increasingly, we are using it more to deliver different type of messages to people and to communities in terms of certain type of behavior in certain area. You mentioned nutrition before. Increasingly we are trying to send out those messages, for example, on nutrition behavior. Increasingly we can do more of this, but I think increasingly we can use these mechanisms to ensure financial inclusion more and more, especially of the poorest and most vulnerable communities that we work with. And I think on this there is a lot more work to do, but the mechanism is there for it. So if it's okay with you, Chad, I'll stop there, and obviously, I'm here and available for questions. Thank you.
Excellent. Thank you so much, Ali. That really sets the foundation for the sort of the next discussion, which we will have, which will sort of dig another layer deeper. I would invite Barbara to now speak with us a bit about how and in what ways humanitarian actors can more effectively address shocks like COVID-19. And keeping in mind the cyclical shocks that we typically face in Somalia that are linked to climate change. We're facing so many shocks on a regular basis. What can we do more effectively to address these moving forward? Barbara? Well, I heard Barbara's laugh. I can recognize that from many miles away. Welcome, Barbara. Please help us dive in.
Yes, I did laugh because I was kicked out for a bit there, so probably didn't hear the last question. However, just to say thank you once again for arranging this dialogue series, and thanks to Kamal and Alessandro for setting the stage. I think it's rather seamless to move into the next question, which is how can we as humanitarians more effectively address shocks like C-19 and cyclical shocks. I think Alessandro has really said it all. And so for me, it's really to say, don't reinvent the wheel. A lot is being done, so definitely need for coordination. We have seen in very many contexts where shocks are being experienced, not necessarily C-19. Organizations go into the affected areas. There is a lot of overlapping. There is a lot of duplication of resources. So in this case, and particularly in a country like Somalia, Somaliland, there is a lot that is going on in terms of coordination. The government is really at the front seat, ensuring that guidance is being put in place. There are coordination platforms that are in place as well. You have mentioned the cash working group as part of your brief. The numbers reached the amount of money that has been expended. The cash working group as well has put up a guidance note on how to go about, implementing in the background of COVID-19. So there is a lot that's going on. The cash working group as well is working together with other entities, the supply chain entity that looks and provides information on whether markets are integrated or not, volatility of market prices as well. At what point should cash transfer be increased? So there is a lot of information. So I think as an emphasis is for us humanitarians is identifying the coordination platforms that are there, using the information and the guidance that is already being shared. We have seen, and Alessandro has talked about it, there is remote targeting, there is remote monitoring. How best can you ensure that, you implement that without putting your staff in harm's way? There are prevention measures that have been translated in Somali. There are graphics that have been done as well. So really going down to the level of the community and ensuring that that language is communicated well. So communication is part and parcel of ensuring that we effectively address the issues that we are facing. Preparedness is what I will get into. Besides coordination, we need to put preparedness measures. The CASH working group, together with the working group, we have been doing a mapping just to have an understanding of who is doing what where. At the donor level, there has been a lot of coordination in understanding how much donors are putting out there for, in response to COVID-19, but as well as in response to the desert locust and other shocks that we are facing in Somalia. The CWG, together with the Technical Assistance Facility, working with the Ministry of Labor and Social Services, we have been mapping at the project level. So just to diffuse and demystify the whole issue of overlaps and deduplication that have been seen elsewhere and with other shocks. Now, the difference between COVID-19 and the other cyclical crisis, I think there has been a discussion, should we call the more frequent shocks or are they crises? And I think I am now becoming more comfortable with calling them crises because they are more frequent, whereas shocks such as COVID-19, desert locusts, these are things that are, C19 is something that has never happened, so it's new to all of us. Desert locust in Somalia, it's something that happens every, I believe, 10, 15 years. So those ones can be called shocks. So the difference here when you're looking at the cyclical crisis vis-a-vis C19 is that the cyclical are more climate induced. So proper preparedness measures have been put in place, whereas with the C19, it's a learning by doing. From the technical assistance and working with the CASH consortium and yourself, Save the Children, what we have been doing increasingly in our preparedness exercises is that we have been working with the local authorities. It's a matter of then understanding what agencies are doing out there and what the local authority is doing also in response to the shocks and crises that we are facing as a country and as a people. And that has helped us a lot because, as I mentioned earlier, we are not reinventing the wheel. We are partnering with a number of agencies and member states who others have early warning systems. We have seen that each member state has its strength, different strength levels. So there are those with early warning systems or are working with early warning actors and have put a proper system in place that informs on shocks, that anticipated shocks, and also ensures that they then put measures early enough. And this is something that we are also pushing for and working together with these member states to ensure that it happens. But at the same time, ensuring that there is centralization at all levels. There is a proper communication between Somaliland and the areas that they are covering, whereas also between the federal government, state, and all the member states that they are working with. So there is a proper dialogue with those two entities because we realize that at the federal state, a lot is happening that is not being communicated at the member state level. So these are communication strategies that we are putting in place. And I would want to encourage humanitarian actors as much to ensure that they don't work in silos, but we work collectively. Is one thing that I would encourage. Also, just in mind is to ensure that we don't act in short term, as in it's good to act in short term, but have the middle term and the longer term, in mind. We have seen in a number of cases, where we have faced floods, humanitarian actors will go in, they will provide assistance, and they will move out. What happens to these people when they move to the recovery phase? They have lost all their livelihoods. So we need to start thinking about that when we are planning and implementing and designing our programs, have the longer term in the picture. And as such, what we are trying to do as well is to ensure that there is a proper coordination between the donors and the government beyond COVID-19, beyond the frequent crises that we are facing, and also embedding this learning that we are getting. As I said, it's a learning by doing, embedding this learning into the social protection system. There is a very good policy that has been put in place and was launched. There are a number of initiatives that are happening with the rollout of the social protection or social safety nets for that matter. So how do we strengthen the capacity of these systems that are being put in place? How do we strengthen the capacity of the government as well in the different nodes of the system? So it's a matter of working together. It's a matter of documenting a number of the exercises and the good practices that we are collecting to enrich, therefore, the system that we are working on and building on. So these are a few things that I would just want to throw out there, and happy to respond to any questions. So over to you, Chad.
Excellent. Thank you so much, Barbara. Indeed, very insightful. Without further delay, then, we'll go on to our last subtopic. So I will ask Christelle from the UNICEF country office to speak with us about how we can really build back better from COVID-19, and what types of investments should we make now to ensure that we're better prepared for next time. Christelle, can I invite you to help us deep dive a bit into that?
Yes, thank you, Chad. Thank you to all the panelists. Thank you also to Kamal and Chad for organizing this. I'm really happy to be here with you. And the beauty with speaking the last is that everyone has already said it all. So when Barbara was speaking, a lot resonated. I mean, like, it really echoed to what I had to say. Because here we are faced by a crisis that a shock. Just to be really specific, after what Barbara has said, we are faced by a shock that really triggered a lot of response from different actors. And this shock also, as she said, we shouldn't reinvent the wheel. So some of the initiatives that the different communities really implemented were part of the private, they used the formal learning, but some also were quite innovative, and we should all learn from that. So having said that, I realized that really from the humanitarian community after Ali intervention and after Barbara's intervention, there was really a lot that I had to say about it. So I'll try here, as given the mandate of UNICEF, to bring the children into the picture. So first of all, let me just say that because the COVID-19 is a humanitarian response, it does not necessarily involve more of the social protection response. Most of it should really be like humanitarian response. And I will really agree with Barbara that this should also be within the framework of the social protection policy, because all the intervention that are being should build the social protection system. We have a policy that is there. We really have also other initiatives. So let's make sure that what we do now contribute to building the social protection system. So in this regard, the involvement of government authorities is key, but mostly coordination and collaboration with the government from all the different actors. I would also like to point out that while aiming to address the immediate impact of this crisis for vulnerable population, but for the matter, I would just say that everyone now was vulnerable. For the specific case of C-19, everyone can be considered as vulnerable. But this intervention should also seek to build long-term preparedness. And this is why I say that I really had a lot of echo from what Barbara was saying, long-term preparedness and resilience of the population. So again, this speaks to building the government system to be leveraged in similar future shocks, because unfortunately we know that Somalia is prone to shocks and crises. So this is not the last shock that will happen. You have cyclical shocks that or crisis. So this will happen again. But if in terms of lessons learned, how do we learn? In the response to the COVID-19, we had a very good use of innovation, as Ali pointed out, what was already done, but new other innovative ways to intervene. We had more increased use of mobile money to deliver the cash. We also have currently the Malta Ministry of Labour and Social Affairs is undertaking a vulnerability assessment, and they are relying more and more on the online survey to really get information on who is most vulnerable and who should get assistance. We should get assistance in priority. So before, I think that when we speak about survey, before this will have been people that would go house to house to do the survey. But now we have also relying more on these online tools or innovative tools as to how to collect information without jeopardizing people or without exposing more to the C-19. So this is also a lesson learned, how to really to leverage innovation when this happens as soon. What something also that I would like to say is that when we look at the health impact of the C-19, children are less affected because it affects more adults. But most of the intervention also are done at the adult level, which is somehow normal because children live in households, so they don't live alone. But those interventions should be child sensitive to make sure that children are protected from the C-19 related socio-economic consequences. When we look at the social distinction measure, schools were closed. So that means what? That means that many children in Somalia could complete only two-thirds of their school year. What about the future of those children? How are they going to catch up in their school year? We have children that we have households that could not access more food as usual. So that means what? That means again children that are more exposed to malnutrition. And Chad widely pointed what are the prospects of children that are stunted. We also saw there are also evidence that violence in general, and most importantly, violence against children has increased during this COVID-19 lockdown or social distancing measure, because children are at home. Adults were not necessarily prepared to stay with children that long. So we have, we also have sanitation, hygiene. So if people are not allowed to move, people will not necessarily how to go and fetch safe water. So these are a couple of consequences that happen specifically for children, in addition to the whole population. So what can we just build back from? How can we build back better from the COVID-19? Build back better is to make sure, for example, that the long-term consequences are addressed, so that the right of the children are safeguarded when we address the response. We have the general response, but we also need to have a child-sensitive response. Because what? Because the investment in children now is for the long term, it's for the future. So I mentioned this investment on child services, on education, on health. We have because Somalia is a very resilient society in terms of picking up on the technology. So maybe in the future, how do we make sure that children still continue to have to access some form of education. And we know that online schooling is not accessible to all children in to the average Somalian household. But this is something we need to think now. If we are really locked down for 4 months, for 6 months, how do we make sure now? How do we collaborate with the education sector to have some form of education? And this can also speak maybe to train the parents, to train the parents that they can continue teaching their children at home when we have this kind of measure. So this is the kind of lesson that we need to learn. Like, okay, how do we start to put in place measure for good parenting? Those children that were exposed to higher violence during this time, how do we do it? But when maybe let me leave from the household sphere to go to more generally to the systems. We have the resilience of the communities, the resilience of household, and resilience of the whole system, of the system as a whole. We have these recurrent crises, we have these shocks that happen, and they do not necessarily have to evolve in humanitarian situation. Putting aside COVID, because this was a shock to the whole world, but we have the low-cost infestation that happened every 15 years in Somalia. Like Barbara said, if in terms of lesson learned, which kind of maybe resistant seed do we have to put, or how do we work with the seed so that the farmers in 10 years or in 15 years, when there is a new lotus infestation, this does not necessarily result in a loss of the whole harvest. So I would say that this is in terms of having a multi-sectoral response. This response cannot just be within the social protection sector, or for the COVID, it cannot be within the health sector. And we saw that starting to happen, but this needs to be more coordinated. It's in terms of really collaboration and coordination, but mostly global, multi-sectoral responses, because what we see now is that a crisis that can start in a sector will have consequences on many different sectors. So I think I will stop here, because in the interest of time, and also we need to have some time for discussion. My key word here will be a multi-sectoral response and coordination, and also alignment to the system that is already in place. Thank you, Chad, and I'm available for any question that you may have. Thank you.
Thank you so much, Christelle, and thank you so much to all of our panelists. So we've just heard from Kemal, Alessandro, Barbara, and Christelle, everything from how COVID-19 is affecting Somali families, Somali new graduates, the impact on remittances. We also heard how we have to deliver cash differently, how we had to adapt, but also mobilizing on the strength of our systems that we already had, which includes mobile money, the technology we already use. We focused a lot on the importance of coordination, the platforms that are available, the information we already have access to. We talked about looking at crises rather than shocks, our early warning and early action mechanisms, which are already in place but need to be strengthened. And we also dived a bit deeper into the importance of child-sensitive approaches, which really requires an emphasis on multi-sectoral responses and stronger coordination between all of us. So as we were talking, a few questions have been coming in. In the interest of time, I'll narrow it down to a few, and maybe I will start with. Let's see. Actually, there's so many great questions coming in. Let's actually start with a question that digs a little bit at the latter part of the discussion first. Actually, a question came in, which is: Somalia is experiencing multiple crises, mostly due to climate change. How sustainable is cash programming in helping communities in Somalia? Shouldn't we be looking for longer-term solutions? Of course, this question is obviously very important within the context of what Somali women and children are facing, and really links in with all parts of the discussion we just had. But I think just to sort of set us off into that, answering that question, we did hear briefly about the social protection policy that was passed in July 2019. We also discussed coordination mechanisms, access to information, and our coordination on early warning, early action, and being more shock responsive. So if I can hear from, actually anyone is free to speak on this, but perhaps Barbara first, because it's relating, I think, really to shock responsive mechanisms. Barbara, do you want to maybe dig in a bit deeper into shock responsive mechanisms and how they can help us to look a little bit longer term?
Yeah, sure. Actually, even before getting to important for us to define what is causal programming, when you look at modality, right? So it's the same as using in-kind, it's the same as voucher. These are purely modalities. They don't own objectives, but they act as a vehicle and reaching the goal or the objective put in place. So for example, if you're thinking longer term, you have livelihood you can talk of where a community creates or puts in place a hole or borehole was to have, you know, enough water to feed their. How best do you motivate this community into doing that which they want to achieve? How best do you immediately meet as they are forward thinking and looking into the longer term goal? One way that has been seen to be is the cash transfers or the use of context. Cash transfers seems to create modality because then so cash transfers as well has, the community is not able to need, but at the same time also meet the needs of the community who are not targeted in that forum. They are getting stimulating that market. So more food is coming in, more market items are coming in, prices are being stable, the whole value and supply chain is being addressed just by the use of cash transfers. Now, when we look at shops and look at system, Somalia and Somaliland in this case, looking at using cash. Why? Because as I said earlier, it is appropriate, it is safe. It does dignity of those who are receiving this kind of assistance. But at the same time, it has look at Asia, you look at the Pacific, where these are countries or regions that face cyclical crisis, and the appropriate modality that's being used is cash. So I'll encourage all of us not to look at cash as a modality, but really to look at what is the objective of putting in place. Are they long term? Cash this objective and outcomes that you say. Over to you, Chad.
Thank you so much, Barbara. Excellent points. We need to not only look at cash as a modality, but also really as a support to markets and economies, and looking also deeper at like the horizontal levels of response. Christelle, do you have anything you'd also like to add on this point, on how we should really be more shock responsive, building back better, sort of relates to your discussion just a few minutes ago?
Yes, Chad. I was just thinking, like in terms of the broad measures that are put in place, and how maybe we should more shock responsive. Maybe something, and this I'm just putting my economic hat, is really tie also to have all these all the the coordination between the donors and the different actors. This coordination also to ensure that all these programs are really implemented maybe in a phased approach, because when the shock happens, immediately we have an immediate response, and we are not sure that usually after we really care or we actually prioritize what will happen first. So maybe also to have this kind of approach where we really have a phase and to say, okay, what do we do right now? What do we do in the medium term and maybe in the long term? And to try to make this more systematic. Maybe this can be in terms of proposal, maybe this can also be in terms of immediate response, to really have this become more systematic. Because yes, we do something right now because we have to do something now, but what happened after? So really to systematize this approach of having something really phased. Yes, that will be just my addition to that. Thank you.
Excellent. Thank you so much, Christelle. I'm going to follow up in just a second with a question for Alessandro. But before I do, I should mention that there's been a lot of work happening in this space on making cash transfer systems more shock responsive. And actually, Barbara, Alessandro, and others have been working really hard on this. And Save the Children is really very fortunate to be involved in different pilots that reach a variety of locations, and they allow us to actually respond to a shock, to scale up our programs both vertically, so increasing the amount of payment for people who are already receiving some form of cash, but maybe slightly lower levels, but also then horizontally expand to reach more people who are currently not receiving any cash at all, and do so extremely quickly in close coordination with local authorities. So those are so there is a lot of interesting work going on in that space to try and really build longer term solutions that can be activated very quickly. Alessandro, if I can ask you, someone has put a question in directly for you about the remote working. So as we do work remotely, does this mean that we're less able to do monitoring, or does it mean that very little monitoring is done? And really great question. How do we make sure that resources reach the right people?
Thanks, Chad. It is a very good question, and not an easy one maybe to answer, but not to actually, make it happen. No, the big challenge was exactly that one. How do we move to work a lot more remotely, but at the same time we maintain needed control in terms of targeting the right people, the people who are in need, making sure that the cash should reach these people, and then monitoring the impact, because we want to monitoring the impact to improve the programming constantly, whether it is the cash transfer value or the system and so on. So that was the big challenge. We have essentially substituted some of the work that was done face-to-face with physical meetings and verification through phone-based surveys. So we develop specific surveys to ensure that we were targeting the right people and registering them. And we have introduced additional mechanism to verify that the same person was receiving the cash on a regular basis. Yeah, essentially that same person is still the one that we register at the beginning and is still receiving the cash. And then the whole monitoring side, the data collection. And again, this is the great opportunity of being, the fact that the mobile network and the use of mobile phones is so widespread in Somalia, is that we could use that system. So the whole monitoring side, that again, normally that data connection used to happen face-to-face, now is all happening over the phone. So we're still doing it, we just changed the way in which we are doing it. And we added some specific survey to verify the work that's been done, to verify who we are working with, these really vulnerable people we should be working with. So is that shift in the way of working and try to make sure that we maintain the quality of the work that we are doing within the new system.
excellent. Sorry, I was on mute. Excellent.
Okay.
Thank you so much, Alessandro. I think I'll just add to the, oh, I thought I heard someone else maybe coming in. I think I'll just add to that really quickly that there is so much effort that really goes into making sure that the resources reach the right people, because one thing that we really take advantage of in using our mobile money systems and mobile wallets, which many people, including us on the call, also use, we do need to have each beneficiary verify themselves with a PIN number when the money is then received on location. Not the cash necessarily, but first just to receive the fund. And then we also have a toll-free hotline number available in all locations. And this is not just Save the Children, this is essentially every humanitarian actor in the country, whereby if a beneficiary has a concern that their money has not reached them, or that they've been asked to give it to others, this can be reported through a toll-free hotline, and then investigations occur based on that. So I'm being given directions from lovely Ayan, who introduced the session today, to bring us to a close and wrap up, because we're actually heading into prayer time as well. So although it's been...
Can I just say something before we close?
Please. Certainly.
Yes.
I was going to ask actually if each one of our panelists can share last thoughts. So Christelle, if we can start with you, that would be really excellent.
Yes, and sorry just for taking this time. Yeah, so what I just wanted to say in terms of also of shock responsiveness, it about that this initiative that is happening in Somalia is the social registry, the unified social registry that is being built, and this is one tool that is going really in the future when it is in place, and when it functions normally, really to be a formidable tool for shock responsiveness, because the social registry is going to really to be fed with information, and we hope that information will be updated, at least updated enough to really give information on the updated information on who really needs to be to receive assistance. And this also will also be used by all the different actors to see really if they can have vertical expansion or horizontal expansion of their program. So yes, this was just my what I forgot when I mentioned about the shock responsiveness is really to really be use the social registry when it's come, but also if anyone has some idea to share with the government in terms of how do we make sure that this social registry is actually it really performs as a tool for shock responsiveness. And I'll stop here because I'm mindful of the time. Thank you.
Thank you, Crystal. Those are really important points, because, of course, there's quite a lot of excellent work going on at various levels and in very close coordination with the government, which we wasn't necessarily objective of our discussion today to get into the details of them, but they need to be mentioned today. So thank you so much, Christelle, because as a point moving forward, we as humanitarian actors really do need to look at what ways we can link up with those systems that are being designed now to ensure that we can be much smarter in our programming in the future. And I should also mention that the Somali Cash Consortium has also done quite an extensive amount of work on harmonizing registries between consortium members and also looking beyond that. So there's quite a platform upon which we can do a lot more in that space. And indeed, that's a very detailed discussion in itself. So what I would like to do is, before we wrap up, I would like to call on Kamal, if you can share any of your last final thoughts with us.
Thank you, Mr. Chad, and the rest of the team, the audience who are watching this wonderful dialogue. Really, I'm recommending 2 to 3 points. Number one, to continue what's called safety net and cash transfer programming to the vulnerable households in Somali context, and as well as I'm also recommending for my final word to say making an establishment of the social protection policy also is very important to our Somali context. And finally, I would like also to say we also need, since we are also talking about the young people, how the COVID affected, we also need to create more jobs to the young people, whether it's private sector, public sector, and different departments of the community. So the young people are enabling environment. So thank you very much for your participation. Thank you very much.
Thank you so much, Kamal. These are really, really excellent last points for us to keep in mind as we move forward on safety net, on the policy side, and also on job creation for youth, which is a very, very strong message coming from Haveoko, a very excellent partner. Thank you, Kamal. Ali, do you have any last points or thoughts that you would like to share with us?
Well, you know, one Chad is really echoing what has just been said. I think as humanitarian organization, we need going forward, we need to work more and coordinate more, not only amongst ourselves, which we do to some extent, but we need to do more and better, but we also need to do that more with the government, particularly in the area that you mentioned, social protection, because of the development on the policy side that have been mentioned, the social protection policies that are in place, that are being implemented. We need to make sure that we work more hand in hand with those systems coming up, contributing to them and working with them. Yeah, because this will mean putting both resources at the greatest use. And I suppose the second area is we have a lot of shocks. There are a lot of humanitarian needs to respond to in Somalia, and certainly many problems, but there are lots of opportunities. And the technology, and in particular mobile money and the mobile network, is one of the opportunities available in Somalia, which we may take for granted because we live either in Somalia, operate in that environment, but it's not definitely given in many other countries in the region, not to the extent that we have it in Somalia. So we are using to some of its potential, but we can do a lot more with it. So we should focus as well in using it to the full potential. Thank you.
Excellent. Thank you so much, Alessandro, for your points on contributing further to government systems and looking more at the shock responsive mechanisms, and then using actually what we have at our fingertips much better, which COVID is actually really the opportunity you had mentioned earlier. COVID is really pushing us in that direction. For, maybe harder. It's a harder push than we may have had in 2020 without COVID. So this is really something we will be focusing on as we move forward. Barbara, do you have any final thoughts or conclusions you'd like to share with all of us?
You know, Chad, it's unfortunate when you're working closely with someone who echoes everything that you had and wanted to say. So Alessandro has basically said all that I had and wanted to say. But just to add on, is that C19, seasonal crisis, you know, they're here to stay. They're not going anywhere, not anytime soon. So how do we work better? How do we coordinate better? How do we leverage the database that we have? Because as humanitarian actors, we have big databases with huge caseloads. How do we leverage that? How do we use the good practices that we have collected over the years to inform better, not only on the C19 response or the seasonal crisis, but also on the government systems that are being put in place? So it's really working together better and sharing good practices and knowing that, the crisis is not going anytime soon. Over, Chad.
Definitely, yes. Unfortunately, the crises are not going away anytime soon, and they seem to be really just becoming more compounded. So like you said, we do have to make better use of our database and also mobilize our efforts better to contribute to government systems. I know, Christelle, you already had shared one final thought, but can I throw it back at you one more time? Christelle always has such useful, we always have such useful discussions. And so if you can share even just one or two other final thoughts in addition, that would be so great to hear from you again.
Yes, thank you so much, Chad, and thank you, Barbara, Ali, and Kamal, because yes, you said it all, just like three words, like multi-sectoral response, and this comes with coordination, and then phased approach, and lessons learned from all these actors, because really, we really don't have to reinvent the wheel. There is already a depth of really a wealth of knowledge out there that we can really learn from, and I will stop here. Thank you.
Thank you, Christelle. Very short and sweet. Phasing, multi-sectoral response, and more coordination. These are really, really key points. On that note, I would like to really thank everyone, all of our panelists who were able to join today. We've, I think, really been able to have a very interesting discussion and involve more people in this discussion in this space that may not always be involved in working on cash. So it's quite important for all of us working on it, but indeed it's also quite important for the Somali society in general, as the shocks ripple through society, and now with COVID-19 on top of it, the impact is quite strong across different social groups, across different wealth groups, and we've been seeing that information come in. The situation is something that we need to respond to at a higher scale. As we discussed at the beginning, we're reaching just under 2 million Somalis now, and that's just around 12% of the population. So in terms of scale, yes, we need to do more in terms of coordination, in terms of phasing, in terms of contributing more to the policy side on safety nets, in terms of really using our resources to best contribute to government systems building, and using better what we already have as an opportunity, seeing COVID-19 as a launching pad to do more and to do better in the future. So thank you so much to all of our panelists. Thank you so much to everyone who was able to join this discussion. I think this is really, sounds to me like the beginning of a very interesting discussion. And so I think we can be reaching out for more discussions on this area as we move forward. And certainly, I think all of the, again, just to thank everyone on the call, we have many Somali civil society and Somali youth who've joined the call today, and you all really have the commitment of the humanitarian sector to continue to respond to the needs of your community to the best of our ability. So we're really here to serve you and your communities. So excellent. Thank you so much to everyone for joining, and continue to write to us should you have further questions, and we can continue to correspond. Thanks again. Bye-bye.
Bye-bye.
Yeah, goodbye. Thank you.
Good job.
Okay, bye-bye, Chad.
Bye, everyone.
Bye-bye.
Salamada, everyone. Bye-bye.